Hello, thank you for joining me for week 4, exercise 1 of the pelvic floor and hip course. You are going to begin on your back. And I want you to feel the base of the pelvis, which is that broad, flat area, kind of at the base, like kind of right before the base of your spine or right at the base of your spine. If you rock a little bit from side to side, you'll feel the weight shift in there. Once you've got that, go ahead and keep one knee bent and you're going to extend the other leg out. You're going to reach I have my left knee bent, so I'm going to reach my left knee forward and I'm going to feel the weight shift onto my right side of my pelvis. So I'm not lifting the right side of my pelvis off the floor, it's getting heavier into the floor. The left side of my pelvis, on the other hand, is lifting up and then lower down. And again, my left knee, it's reaching forward. That's what's lifting the left side of my pelvis. So if I show you from the side of the leg that's doing it, I lift, this reaches. When I come back to the floor, I feel that side of my pelvis fully settle into the ground. And then go ahead and switch sides. Feeling that right knee reach forward. Feel how that right hip lifts. There's more weight on the left side of my pelvis this way. And then when I release it, I come fully back to the ground. So I feel the weight of the right side when I release it. I feel the weight of my left side when I'm reaching my right knee forward. Now, for your second round, go ahead and switch the legs and take your hands up so that your hands are clapping. You're going to press through the left foot so the left knee reaches forward. You're on the right hip. When it feels like you can't go any further, rotate the arms to the right. So you're on your right side. To come out of this, bring your arms back first and then release the hip to the ground. So knee reaches, arms go. One more. Go ahead and switch sides. So again, knee reaches. I'm on the left side of my pelvis now. Arms rotate. I'm on my left shoulder. Arms come back. I'm off my left shoulder. Release the right hip back to the ground. Right knee reaches. Rotate. One more. Let that go. Give that a try and see how it goes. Thank you.